Huh? What do you mean? We have the amendment going. It's all done, it's just being reviewed, so I should have it by the end of this week, and I'm gonna talk to the police officers and go through it with them, and then I'll show you guys. I actually have a text out to Marty to find out what's going on with it. I haven't heard from him.
Just ask me, does anybody really
I do.
anywhere?
Oh, well,
No.
good question.
Okay, I will call the Senate Finance Committee to order. Do I have a motion to go into executive session? We have a motion and a second to go into executive session. All those in favor say aye. Aye. All those opposed say nay. We are in executive session. You have your list that Deb put out. We are not going to do any of the House bills today unless the senators bring it up at the end. And then they'll probably just be for discussion. If we look at 390, Senate Bill 392, 394, 397, and 551, we expect those to be all subjects of fiscal actions. And so, again, unless somebody wants to do something with those, they are going to sit there until we know what actual action fiscal takes, and then we'll put them on a short fuse and we'll take them out. If fiscal doesn't act in time, then we will put a recommendation on them, take them to the floor, and then have the discussion on the floor what to do with them.
Next week, the fiscal on the 20th.
Yep. So more than likely, by then we will have had the books and we will know at least what the indication is, and then we'll go from there. I mean, we're going to do as best we can, but it doesn't do us any good to pass them, you know, if we're going to use ARPA money to take care of them.
That's 392, 384, 397, 551.
Yep.
And what about
And there's a
590?
bill on the table. I've forgotten the number that deals with the SBDC pumps.
Right. Okay.
And what about Senate Bill 590?
590, we, as best we know, and I'm certainly interested in what you guys know, that is going to be funded from the federal government, and that we really don't need to take action on this bill. But where we are, I can't tell you.
Did the governor declare it a disaster?
It's been approved as a disaster, is my understanding.
So they should be expecting people.
Yeah, I mean, we should probably ask that question to Senator Altshuler, since it's her bill.
And
You guys want to put your,
does FEMA doesn't it require a 25% local match?
Yes.
Which
in some cases, we have contributed.
And it's a great thing for Senator Altshuler to work on
Well-
if it does.
Chris, maybe you can,
We
follow.
do 12 and a half.
We can certainly do that, but typically the FEMA does require a local match of 25%. Sometimes the state has split that with the local. Sometimes the state has taken the full amount, so it depends on what type of disaster and when that disaster has happened. But more recently, I think it's been a 12.5 split.
Yeah, right. Okay.
Further discussion on 590? Seeing none, we'll move on to second committee bills. 134, that is actively being worked. It is certainly, Senator, if you'd like to speak to it.
just so you know, we've been working on it. Marty Carlin's been doing the lion's share of it. I think we have an amendment all set to go. We're just getting everyone reviewed. There was a change from the Attorney General did not want to be it wasn't in their purview to determine whether it was a violent action. It's typically in the Commissioner of Safety's purview. So the Commissioner of Safety is putting some language together to put in the amendment, and then we're going to peruse it, and then I'll sit down with the officers, go over the changes, and I'm hoping to have something. Obviously, we need something by, I think, next week.
Great, thank you.
Further discussion? Okay, moving on to 309. Relative to the vesting period. This one is going to go back on hold. The reason, when we look at the bills that are there for the retirement system right now, when you look at the bill that would take how many years of service they needed to go from 2% to 2.5%, if you do it at 10 years, the estimated cost, and again, I'm going to use round figures, about $55 million plus 5-point-something million a year cost thereafter. If you went to 15 years, it would only be $23 million plus a $3 million plus cost for every year thereafter. On 309, the vesting period, when we were in the committee, we believed that this was not going to cost us much at all, but right now the fiscal note on this says it's going to be 1 point whatever and 2 point whatever for a total of about 3 point whatever per year. And when you add that with whatever we do on the other one, and I use my scratch pad, I don't know how I get there, okay? And if I have to cut something out of this, this is one of the first things that would go. We've never been below 10 years on a vesting period, but again, it is on hold. People should be aware that we're looking at it, and we've got to look at the retirement system, in my opinion, as a whole. We can't look at each one of these individual pieces. We have to say, what are we going to do with the whole thing? And look at the total dollars that it's going to cost to do Part A, Part B, Part C, whatever parts we decide to do. So it is on hold, and stand by and talk to people, and we'll go from there. 358 is the next one. Senate Bill 358.
I'll move on to pass.
Second.
We have an ought to pass motion by Senator Bradley and seconded by Senator Birdsell. Discussion. Seeing no discussion, all those in favor of ought to pass say aye.
Aye.
All those opposed say nay. No. And the ayes have it, 4-2. And Senator Pearl, did you want to take that one out?
I will take that one out.
Okay. 366.
I'll move ought to pass.
Senator Birdsell moves ought to pass, seconded by Senator Pearl. Discussion? All those seeing no discussion, all those in favor say aye.
Aye.
All those opposed say nay. The ayes have it, and that's 6-0, Senator Birdsell for the committee. Okay, 404.
I'll move ought to pass.
404, we have Senator Birdsell and Senator Rosenwald, ought to pass. Okay. All right, Senator Rosenwald moves amendment to 1278. Do I have a second?
Second.
Can I
Okay.
explain it? Thank you. So it does two things. One, the original bill had no source of funds in it. So the last sentence is the warrant article that specifies It's general funds, which we think was the intent, but was left out of the original bill. Also, on line 3, the department came back recently and said the IT work would cost a bit more money. I think that it had been in the 200,000s for the IT, but this amendment includes their updated cost estimate, if we choose to give them that.
Okay. It should be noted that there is another amendment. All right, further discussion? All those in favor say aye.
Aye.
All those opposed say nay. Nay. And the motion fails. 4-2. Senator Bradley, you have a motion?
So, rather than come in with an appropriation, so purports to be a new program, even though it's a pilot program, I think it would be much better to have the department have a reporting requirement to come in as part of their budget presentation of how something like this can potentially fit into the next budget. I think we have tried to, thank you, we've tried to prioritize second year spending in this committee, and while I think this is a worthwhile endeavor, I just think others like well, obviously the YDC, but the cancer screening, the hunger initiative that we passed last week on the floor, some of the homeless services bills just rise to a higher priority. And I think in the long run, this is the best way to have a debate about this next year with the potential for funding.
Senator Bradley moves Amendment 1319S, and I will second that. Further discussion? Senator Rosenwald.
Thank you. I generally agree that we should not be reopening the budget, but we have been. And I think we've been hearing consistently from employers that childcare is hindering their ability to hire employees. We see it in the numbers of younger women with younger children who have stayed out of the workforce. This is simply one more tool to help our employers fill the jobs, and so I'm sad that we're kicking it down the road.
Further discussion? The motion is on the amendment, 1319S. All those in favor say aye.
Aye.
All those opposed? No. And 4-2, the ayes have it. Now we are on the ought to pass as amended. Now, is there any further discussion? All those in favor of ought to pass as amended say aye.
Aye.
All those opposed say nay. The ayes have it and is adopted. And I will take that one out. And 407, the ambulance service. I have my notes say that I want to put that on hold, along with 410. Moving on to 417.
Hold on that one too. Or, no.
Right before the meeting, Health and Human Services did come in and say that they are looking at the fiscal note and gave a rough estimate of where they thought it was going to be. And in fact, we might as well let you come up and sit in that chair and so people can ask questions. I forced them into giving me at least a quick estimate, And so. I'll
And
let
that was
you-
wrong, so. My name's Krista Morris. I'm the Director of Intergovernmental Affairs with DHHS. The portion we were concerned, or not had concerns about, the portion that impacts us fiscally is the portion that was also in HB 1573. So I kind of went off of that fiscal note, forgetting that there were other parts of 1573 that I needed to take out. Quick back of the paper math outside, I believe, was about $700,000 for the impact. But I do want to go back to our staff and make sure I'm looking at that correctly and that I have the actual correct number and broken out for the staff.
With that high a price tag, I think that we probably should hold until we get back so that we can at least discuss it. Is there anyone?
Can we discuss Regina's
Sure.
amendment?
Regina wants to,
I just want to change on page 2, line 12 and 13, where it says, "A parent's failure to cooperate with the department's assessment or to provide any records necessary to such determination," it currently reads, "shall be weighed against the fitness of that parent." I believe I would prefer to say, "any records necessary to such a determination as weighed as a factor in the fitness of that parent versus weighed against."
okay. If we're going to hold on this and not, certainly we don't have to hold on this, we can consider any changes that would happen in the fiscal note on the floor when this bill is heard, and do Senator Birdsell's amendment as a committee amendment, or it can be held with the 700,000.
Well, you're not gonna move on it,
I can't.
right? So if you're not gonna move on it,
That's what I'm saying,
Yeah,
is
why
I
don't
can
we just-
move on it. If we think that the 700,000, which is the rough estimate right now, is in the ballpark, and we believe that the out-of-state, out-of-home placement for the children certainly is a priority.
oh, I think it's a priority. I mean, look, we've already had a series of problems with out-of-state placements.
So-
that we've had to bring the kids back, so that, I think it is a problem.
It's
Now-
certain-
Now the question is, do we make the change suggested by Senator Birdsell? That's the first item of business, and the second item of business is, do we take a risk that 700,000 is the number and vote on the number, and if it isn't the number, do you table it when it comes to the floor of the Senate? I mean, the question is, how anxious are we to move this forward at this point in time? We don't know the basic number, but we do know that you want to change.
Certainly, when I discussed this with the other senators, it is a priority that we wanted to move forward with today with the amendment that Senator Birdsell suggested as a committee amendment to get it going. And then that's when, leaving that discussion, when Health and Human Services contacted me about the change in the amount of money. I am, again, because of the reason that we're doing this, I don't really have a problem with doing the floor amendment as Senator Birdsell suggested and moving it right to the Senate floor, and then if
You mean the
there,
committee amendment?
a committee amendment, and then moving it to the Senate floor, and if we need to make adjustments, do the adjustments as a floor amendment. It's up to you. I only get one vote.
So, question of Ms. Morris.
It's gotta be Mike.
Could you just outline what the costs are?
Sure. So from what my staff have told me, and again, we'll provide better detail of this, is while some of the parameters laid out in 417 are items that they are already doing. Some of the other items, some of the people they are meeting with, the level of discussion would expand the time of those visits. And so you have to account for, every month that's an increase of 3
So like
hours per
child service
child.
workers would be an expanded,
Correct. So they meet with the children monthly, and this would go from possibly say a 1 hour visit to maybe a 3 to 5 hour visit. And then sometimes that will then impact hotel stays if it's out of state, travel costs if it's out of state, because there aren't always direct flights to and from locations. So, we have to try to think about those what ifs when looking at these fiscal impacts.
and further, would you say that the $700,000 that you cited is back of the envelope, or do you have reasonable assurance, I guess, that it's within the ballpark?
It's within the ballpark for the CPSWs and JPPOs, the caseworkers, and then the juvenile probation officers to go out. But then also there is another portion that would include a couple of attorneys. And so I want to make sure that all the language lines up so we're getting the correct number to the correct language, because there have been different iterations for HB 1573, which is where we're getting some of our numbers from. And I want to make sure we are actually lining those up correctly.
And would an updated fiscal note be ready, by next week with any changes that might need to be made to the language to reflect what you just said?
By the end of this week, absolutely. By the end of this week.
Friday. Senator Bertzel was next, and then Senator Rosenblum.
Well, Senator Bradley just asked my question about when it would be ready.
Yep. Senator Rosenblum.
Thank you. I was just wondering, since I know the Senate President has an intention to have an addendum Deb Martone calendar next week, whether we could have it on the floor next week, regardless of whether we move on it today or next Tuesday, but have better information.
I mean, we're probably better off buttoning this up with an updated fiscal note. So we're gonna definitely want to see it per the chair's order by Friday.
Absolutely.
Okay.
And that way we can see Senator Bertzel's amendment as an amendment too.
All right. So Senator Bertzel, you have a go-do, and Health and Human Services, you have a go-do. Moving right along, I've got 442 on hold, and going to 455.
A second? She already did, never mind.
She beat you to it.
Yeah.
Okay, so we have an auto pass motion by Senator Pearl, second by Senator Rosenblum. Discussion. Medicare reimbursement for prosthetics and orthotics. Senator Bertzel.
I'll just, since it was in my committee, it's come to our attention that we have very few orthotics and prosthetics businesses, but many of them are really losing business because of the cost. So Senator Prentice put this bill together to kind of keep them in business. So I would highly recommend we support this.
Further discussion. The motion is ought to pass. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. And Senator Bertzel, you get to take that out. 487. pass. Senator Pearl moves
Second.
ought to pass, seconded by Senator Birdsall. Administrative Services, discussion. Senator Pearl.
So this is a bill that we had in ED&A, and if you recall, last week on the floor, Senator Carson had a floor amendment that fixed the concerns, and we overturned the interim study motion that we had originally put out, and she brought forth a floor amendment that fixed concerns that, with some of the stakeholders that were involved. So I see no reason not to pass this bill as we amended it last week on the floor.
Further discussion? Seeing none, all those in favor of ought to pass, say aye. Aye. All those opposed, say nay. The ayes have it. Senator Pearl, you get to take it out. 495.
I'll move on to pass.
Senator Bradley moves ought to pass. Senator Pearl seconds. Okay. Treatment facilities. Okay. Further discussion? Seeing
So,
none.
I have an amendment.
Senator Bradley.
Yeah, Amendment 1318, similar to what I said about Senate Bill 404. There's a good initiative, needs to be done, but there are new positions that have to be created. So what this amendment does is directs the department to come in with a plan as part of the budget.
Senator Bradley moves Amendment 1318S. And Senator Birdsall seconds it. Senator Rosenwald, you had a question?
Well, comment on the amendment, really. I'm more worried about this amendment because the substance use disorder treatment and recovery system we have very limited transparency and oversight. We only license the residential providers, so we have oversight there, but the outpatient treatment providers are really largely exempt from state oversight, and we don't even know who a lot of them are or where they are or if they don't take Medicaid. And all of our drug courts are referring people to them. And even if these outpatient centers do take Medicaid, only 9 of the 65 providers that are Medicaid enrolled have contracts with HHS. So that's less than 15% of the providers who are getting taxpayer funds are without really any state oversight of whether the programs are run safely or according to best practices. And I think this really matters because we've seen horrible abuse in this system, specifically with Mr. Spofford and his Granite Recovery Centers, where he was accused of sexual abuse by multiple clients at very vulnerable periods in their lives. And I think we're making a mistake by kicking the can down the road here and delaying better accountability for patient safety and taxpayer funding. I think we could move forward with the policy in this bill, and we could even delay the effective date. But this really just doesn't really do any direction to the department. And I know that the Health Committee, which 2 of our members sit on, voted for an amendment to move the whole thing up to more quickly to make it effective on passage. So I don't know what happened in between last week and this week, but I just think we're spending a lot of taxpayer money in this system, and we really don't know what's going on. Thank you.
Thank you, Senator. Senator Bradley.
So I don't disagree with anything you said. I'm a co-sponsor of the bill. I think it needs to happen. But, you know, what changed is that we've appropriated $60 million to the Sununu Youth Center. So I think every other funding initiative has been scrutinized. And the department, when I proposed exactly the idea that you said of implementing the policy, removing the appropriation, removing the authorization for staff, and making the effective date effective July 1 of '25, which would give the chance for the budget to approve it, they balked because we're basically saying you have to do it, but we haven't provided any funds for you, even though the effective date's out in the future. So I understand where you're coming from. I think this gets it done in a way that hopefully will get done better than mandating it with a pushed out effective date.
Senator Rosenbaum.
Thank you. Gosh, I hate to argue with you, but I think all it does is require the department to issue a report. It doesn't put any shape on what that process should look like. I mean, I think even if we move the effective date of the bill and remove the ombudsman, that would cut down on the cost. But I just think we're leaving some very vulnerable people continually with a lack of oversight and accountability, and I really think we can do better.
If I might, Mr. Chair, either way,
Senator
whether
Bradley.
we move out the effective date or ask for the department to come in with a plan, we are kicking the can down the road, either way.
Senator Rosenbaum.
We're telling them what factors they have to consider.
All right, seeing that we're not really getting anywhere. The motion on the floor,
There is maybe somebody.
Senator Bradley, if you want to speak, please turn your mic on.
I think there may be somebody from DHHS that would want to comment.
Is there anyone from the department who would like to comment? Oh, we have a volunteer.
I don't know if it's willingly,
Just turn the mic on and introduce yourself. You want to come up too? You can come up.
any of my colleagues could join me, yeah.
Sacrificial lamb.
Yes.
I think Jenny has it.
All right. Introduce yourself. And
Absolutely, yep. I'm Jenny O'Higgins. I'm a policy analyst at DHHS for behavioral health. So I think the department has, spoken with many of you and through the HHS committee as well around the issues that are concerned here. And I think, from our perspective, I think either thing is potentially possible that you are discussing in terms of we cannot certify 100 plus outpatient facilities without the staff to do so. So the fiscal note worksheet was able to allow us to talk about the positions required to do the work well. We can, however, start the rulemaking and start to work with the community and all of the SUD providers to get through that rulemaking process. We just need to be really thoughtful about how we do this, and so that we can do it really well. And the other piece is that when those facilities are certified, they would fall under our existing ombudsman's office, and so would already have the protections of that office. We were looking to we've been working with New Futures on this bill, and we're looking to potentially add a position within our existing ombudsman's office as opposed to creating a behavioral health ombudsman's office, but just rather have someone with specific expertise in that area. So we have, that fiscal impact sort of worked out in terms of what we think we'd need for staff, and could begin the work around how would we implement the certification, which will take a while anyway, but we will require the staff to actually implement.
questions from the senators? Senator Bradley.
So think I'm understanding, but maybe I'm not. If we went back to the bill, as opposed to the amendment that I just talked about, how could you do it without the staff positions and just begin the process of creating the rules?
I apologize if that wasn't clear. I meant the idea of amending to push out the effective date. There are also some required amendments to the bill as it passed HHS. It still includes facilities that are already licensed, so there are additional amendments that would be needed within the bill. But there was an amendment that we worked on with New Futures to try to get to a place where it would remove the requirements for those facilities that are already licensed by HHS, and that would push the effective date out so that we would be able to begin the rulemaking process, although we cannot do the work until there is an appropriation for the positions.
All right, so let me, if I can do a follow-up. If
Yes,
we
sir.
suspended consideration on the bill, could you bring in the changes that would be needed to be made to the base bill by next week so that we could exec the bill then without an appropriation?
We do have those changes prepared, yes.
All right, I'd be good with that.
Okay, Senator Bradley retracts his motion on Amendment 1318S, and Senator Bradley takes back his motion of ought to pass, and we're going to put this one on hold, and we will discuss it next week.
All right, the one thing I would say is work with Kate Lippman on this amendment to get it to us. Thank you.
And when you do the effective dates, because this is quite a lengthy bill, you want to pay attention to the ones that you need done first. So there should be multiple effective dates in here based on the sections that you can do without the funding and then the sections that you would need the funding for. Okay? So just make sure that you do that, because it's not going to do us any good if you give us an effective date out in 2026 and you don't have the authorization to actually do some of the pre-work for rules, et cetera. Senator D'Alessandro.
Thank you, Mr. Chairman. So what you're going to bring to us is a strategic plan of how things are going to happen, the time frame from which they're going to happen, and that be pretty definitive. And then from that, there'll be a cost associated with that.
Yes, you should.
So what we have prepared is an amendment to the bill that would fix some of the tactical specific issues tangibly that are in the current bill as passed by the HHS committee, and then would have the effective dates for the pieces that could begin today. The rulemaking portions that will take significant dates would need to be further out, if that would require appropriations and positions to be in place.
Okay. So further question. So
Absolutely,
there'll be clarity on your part as to the implementation and the process by which that'll occur.
I will say that much of the clarity for how we would implement this will come from the rulemaking process. So it will be, there is some clarity under how we will begin the rulemaking process, and specifically the current rules under RSA 172 say that we can only certify those treatment facilities for which we are contracted with, for which we give funding to, which, as Senator Rosenwald mentioned, is 9 out of over 100 that are registered with Medicaid. So we know the landscape is much broader than what we can currently oversee. So that's why the rulemaking will be significant to determine how we will certify.
Okay.
All right. I
Thank you.
also think that it would be a good idea for you guys to meet with the Democratic caucus and as many of the Republican caucus that we can get together, or individually maybe, but to brief them on the changes once you get it put together in a package with the effective dates. So, all right.
Thank you.
So that one goes back on hold. And the next bill on our list is Senate Bill 522.
move on to pass.
All right. Yep, Senator Bradley has moved on to pass, seconded by Senator Pearl. Discussion, Senator Bradley.
So there's a pretty big price tag to this. I think ought to pass would be with the understanding, and I believe the sponsor is okay, that it goes to the floor and it's tabled, and the sponsor can bring it back next year as part of the budget.
Or if somebody gives us a couple of $100 billion, then we could, you know, add it to anything if it's a Senate position that we've already passed it, right? All right. Further discussion? Seeing none, all those in favor of ought to pass, say aye.
Aye.
All those opposed, say nay.
No.
And the ayes have it. And I will take that one out also. Any other bill that any of you senators want to discuss?
Just an update, I just got a text from Marty. They're waiting for safety, their attorney is off today, but he'll be back tomorrow, and they have messages in to get an update on my amendment for 134.
Okay,
Move out of exec.
we have a motion to come out of executive session. We have a second. All those in favor say aye.
Aye.
All those opposed say nay. Our business of the day being complete, we are adjourned.